Good day, everyone. Today's article is titled Analgesic Efficacy of Low-Level Laser Therapy for Post-Operative Endodontic Pain, a Systematic Review and Meta-Analysis. It was done by Brazilian group and was published in Australian Endodontic Journal in 2026. This systematic review and meta-analysis evaluates the analgesic efficacy of low-level laser therapy for managing post-operative pain in endodontics compared to conventional drug therapy or placebos. Post-operative endodontic pain is a common clinical concern, with incidence rates between 2.5 to almost 70%. It is typically caused by periapical inflammation from mechanical, chemical, or microbial factors, while conventional pharmacological management, like NSAIDs, is standard. These drugs are often associated with adverse effects. Low-level laser therapy or photobiomodulation has emerged as a non-pharmacological alternative that may reduce pain by stimulating the cellular respiratory chain, increasing ATP synthesis, reducing inflammatory reaction induced by LPS, and inhibiting nociception in nerve fibers without reported adverse effect. So, a comprehensive search was conducted across multiple databases for clinical trials assessing pain intensity up to January 2025. A quantitative synthesis was performed for studies with comparable methodologies, focusing on pain levels at 24 hours post-operatively. For the inclusion criteria, the review followed the PICUS framework, where the patients were individuals undergoing root canal treatment, the intervention as using low-level laser therapy, and the comparison is with analgesic anti-inflammatory medication or placebo, and the outcome is post-operative endodontic pain levels, and the study design included were clinical trials. They excluded review articles, case reports, case theories, and expert opinions. For the measurement of outcome, post-op pain was assessed using validated pain scales, either visual analog scale, verbal rating scale, or numeric rating scale. For the results, 9 randomized clinical trials were included, involving a total of 632 patients. The included studies demonstrated variation in treatment protocols, either in treatment visits, single or multiple visits, or instrumentation technique used. And there were variations in laser type and parameters, as well as application time, where it ranged from 40 to 160 seconds. 8 of the 9 studies demonstrated that low-level laser therapy was more effective in modulating post-operative pain than control intervention. And for the meta-analysis, analysis of 5 studies showed a statistically significant reduction in pain with low-level laser therapy compared to placebo at 24 hours post-operatively. So, low-level laser therapy appears to be a promising non-pharmacological intervention for post-operative endodontic pain management. The findings suggest it provides significant analgesic effect compared to placebos and NSAIDs like ibuprofen. However, the review notes that the overall certainty of evidence is moderate due to methodological limitations, such as inconsistent blinding procedures and variation in laser parameters, where the wavelengths used ranged from 660 nanometers to 980 nanometers. The article concludes that low-level laser therapy may improve post-operative pain control following endodontic treatment. While current evidence supports its efficacy, the authors emphasize that additional high-quality clinical trials are necessary to standardize protocols and strengthen the evidence base for its clinical application. Limitations of this study include substantial heterogeneity in the methodology of the included studies, and also the operator blinding was not universally applied, which will affect the interpretation of the results. And thank you so much.